Welcome, doctor, and thank you so much for your time. I absolutely
Welcome.
know how busy you must be with the current situation that's going on and with the number of patients which are going online and offline. So, thank you so much for your time. Doctor,
Welcome, sir.
for the viewers, I would just like to introduce Dr. Rajas Deshpande. He is a great doctor, and I will tell you why I'm calling him great. Uh, he is MD medicine, and he also has done doctorate of medicine in neurology and fellowships in multiple sclerosis, movement disorders, and Parkinson's. And he is also the author of the book The Doctor Gene, and he has a huge following both on Facebook and on social media uh, for the way he writes, for the way he explains everything in such a simple way, and for the way he actually fights for the other doctors who are currently bravely facing the COVID pandemic. So, Doctor, it's a great pleasure for us to have you on this video session, and this is a great opportunity for me. And the reason, doctor, I called you great is because I have some people in my family, right, who had consulted Dr. Rajas, and I went with them for the consultation, so I was accompanying them. And doctor, there was something which was unseen in whenever I had met doctors, I had never seen this, right? So first thing was that I think the appointment started just 2 minutes late because we were weighing outside or something, and it even if it started just 2 minutes late, uh, you said, I mean, you apologized for the appointment starting 2 minutes late. I mean, that is something which is not seen, absolutely not seen. And when we were asking questions, and a curious person like me has multiple questions always, the best part about you was that you patiently listened to all the questions, and you answered each and every question, very patiently and with a lot of clarity. So that is one of the reasons why I'm calling you a great doctor, and I'm so happy that we are connecting today.
Thank you, Omkar. Thank you for your very kind words, and I'll be very grateful about this. But I do not really think I'm a great doctor. To me, a great doctor is one who is actually in the rural India with his MBBS and MD, serving the poorest of the poor patients who sometimes cannot pay, who cannot afford, and who's using only his brains, not the lab test, not anything else, who's using only his brain and hard work to save their lives. So the great doctor in India is in fact the one who is working in rural India. We are uh, trying our best to accommodate to the advances in medicine, but there is some population in India which cannot reach us, and those who are taking care of those patients, I think those are really great doctors in India. We do whatever we can to bring the new advances to India. So thank you for your kind words, and I think there's nothing extraordinary in a doctor having to apologize or doctor having to answer all questions. It is the duty of a doctor to be a first a good human being, and so he should follow all the etiquette and manners, and it is also his duty to reply to all the relevant questions that the patients or the relatives ask. So by all three criteria, I think I'm just being doing what is my duty and nothing else.
uh, you hold a great state of respect in my mind. So
Thank you.
today I actually wanted to talk to you about and discuss about a few things, especially for the motive of spreading awareness. Because recently, what is happening is that in our company HealthSpan, a lot of people are coming with chronic conditions where they have certain chronic conditions like diabetes or like PCOS or thyroid, and then the doctors tell that there are lifestyle. I mean, if you improve your lifestyle, if you improve your exercise activity levels, or if you improve your diet, these conditions can actually get better and better. And even though there is not a lot of awareness about these conditions, there is some. But doctor, especially about these conditions like Alzheimer's or Parkinson's. Like a couple of days back, it was World Alzheimer's Day, and that was when I got into reading about Alzheimer's, deep reading about Alzheimer's, and that is when I got interested in this, where uh, I would like to discuss about these conditions with a real expert like you. And doctor, before we do that, I would really like to know about your journey of becoming a doctor.
All right. One of the reasons I think I can become or I should become a good doctor is that sitting in this chair of a doctor, I cannot lie. So nothing that I will say about my journey today should be a lie, and that's why I'll keep very honest. I became a doctor because my parents wanted me to become a doctor, and it was never in my mind to challenge them, or not because I disliked being. I mean, I enjoyed it. I didn't think much about it of thinking of the only other career probably I would have chosen is either a racing driver or an astronaut or something. But this was not bad either, and this was easily available in India, and I qualified for it fortunately, and I always enjoyed this role of a hero or savior that our society has given to the doctor, that you can save lives, and that concept that builds up in your body that yes, I can do something for relieving people from their suffering, and that goes on building. And it is also a feedback phenomenon. Like if you do something good for the patients, they can, like you said, some beautiful words about me that encourages me to be still better tomorrow, so that kind of, if you save patients, if you help their get better, they will come back and they will tell you so, and that becomes your energy, that becomes your petrol. So I wanted to do more and more, study more and more, and a little bit of ego is there. Everybody has that. I want to do the best degree in the world. I want to qualify for the highest academic levels in the world. And fortunately, things kept on happening. I think all through this, more than my wish, the feedback from patients that I was getting, that I was actually being helpful to save lives or to reduce suffering in some other people's lives. That is the biggest motivation, I think, not only me but most doctors have.
And how was your journey of becoming, and how did you choose your specialty? I mean, were you always interested in neurology?
I was more interested in neurology in my MBBS days, but when we did our MD medicine, at that time the choice or the top branches were cardiology and nephrology, because these have a certain glamour associated with them. But as I finished my MD and I was preparing for my DM entrance examination, which is the super specialty examination, I was taking classes for MBBS students, for their third MBBS students. And for while teaching them, I got more interested in neurology. This was more of a challenging science. It was not related to only, a small part of, angiography, angioplasty or catheterization. Of course, that requires a huge skill, that requires a huge input and hard work and all. No branch is above or below. But what appealed to me about neurology was that it was so vast, so complicated, so challenging, and there were so few people who understood it well. So I thought this challenges my brain far more, because the things that I don't understand, the more I want to learn them.
Oh.
If I know everything, what's the fun in living? So that's one motivation.
And coming to the topic of these conditions, especially related to neurology, when we talk about conditions like Alzheimer's or like Parkinsonisms, so can you please share us some basic information about these?
Yes. Let me first speak about the common things between these two illnesses. One, the fear created around these two names, Alzheimer's and Parkinsonisms, I'll to some extent blame the Western world for that. See, we have, as Indians, probably we are a little more spiritual, and we know this side of life, that everybody is going to have to face death one day, and everybody is going to degenerate some way or other. Either the heart will degenerate, or the kidneys will degenerate, or the liver will degenerate, or all together one becomes old. So same way, why is it so difficult for some people to understand that the brain also will degenerate according to age, and in some patients it might degenerate a little earlier? So it's not that that particular illness is more dangerous than any other illness. In fact, kidney failure is far more dangerous than Alzheimer's or Parkinson's, or cardiac failure is far more dangerous than Alzheimer's or Parkinson's. But people are a little scared of these two because of two things. One, the slightly glamorized concept of losing memory that scares people, and that's a very difficult dilemma question to answer. Would you like to be physically impaired or mentally impaired? The answer is very difficult to, because both suffer to some extent, and the spectrum of suffering is different. But Alzheimer's scares people with the concept that they suddenly one day will wake up with no memory, which is not true. That process is always gradual. That process happens over a period of time, months or years. Very rarely it happens fast, and the patient never lands into Alzheimer's suddenly, except in some conditions. And this is why it becomes a little more confusing, that a patient is developing Alzheimer's over a period of time. He has had some memory loss or some cognitive loss over a period of few months, but has never had a proper conversation with people at home. That is the most difficult thing that we ethically, morally face today. That if I ask you, or if you ask me, what conversation did you have with the elderly people in the home today? It is always a yes or no combination. Did you have your food? Are you okay? Did you sleep well? Do you want something? We never have a meaningful conversation with the elderly in our house on a daily basis. Very rarely we have that. So we often do not know that they are cognitively getting worse. For months together, we are unaware, because Alzheimer's does not cause change in these colloquial conversations. How's the sunlight today? Is it raining today? Do you feel cold today? Did you have a nice sleep? Are you hungry? These conversations are never affected by Alzheimer's in the early stage. Only if you go on assessing the cognitive functions properly, or if you carry a longer meaningful discussion, you will know that the patient has had some memory lapses. So by the time the relatives realize that this is happening, it is either too late, or such patients, they get admitted for some other minor or major surgery or some illness. And during that admission, when the doctor assesses them and when the family attends them for a longer time, then they realize, and they blame it all upon that surgery or that illness.
Oh.
Surgery ho gayi, tab se Alzheimer ho gaya. This concept is wrong. The patient was having it for a long time, and then surgery just precipitated, unmasked it. That is the. So there are many warning signs of Alzheimer's, and these should be watched for. A person who's having difficulty in naming things, difficulty in remembering things, difficulty in most recent things. Where did he keep his keys or pen, or his clothes, or which way outside the home, or which way to come back home, finding doors, bathrooms, getting lost, not replying to questions relevantly. These are early signs that the patient may complain of, but the family usually attributes it to the old age or stress. So this is the biggest mistake that we do, that for a long time after Alzheimer's complaints have started, families or even the patients keep on attributing them, this is because of stress or this is because of age. And then suddenly one day it becomes very severe and then you come to the doctor. So that should not happen. So there are warning signs of Alzheimer's, which one should watch for. Similarly, for Parkinson's also, Parkinson's is degeneration of a small part of brain called basal ganglia. One of the nucleus in basal ganglia, or associated with basal ganglia, that starts degenerating, and the chemical called dopamine is reduced in body. Now this dopamine is like petrol for the car. And the worst thing that happens to Parkinson's patients is that because there is no dopamine, they start becoming slow, they start becoming stiff, and they also have tremors. The typical Parkinsonian tremors develops. Unfortunately, most of our educated families think that such patients, they are slow because they are depressed or they are not having the willpower to get up and walk. It is like telling a car without petrol that you should run on positive energy, you should develop a willpower. The car will not run on a willpower, it will need petrol. Likewise, the brain will need dopamine. You cannot force it. And that's why the patient feels they can understand, but they cannot tell their family that it is indeed impossible for me to get up and move. So that is the worst thing. But one of the first signs of Parkinson's that develops, besides, people think that they should have all tremors. No, tremors are not essential every time. Sometimes the most common thing is they develop shoulder stiffness. Many a times they are diagnosed as a frozen shoulder, or sometimes they develop low backache, and sometimes they develop stiffness in the legs, which is thought to be knee related stiffness, and knees are operated. So every patient who's developing stiffness like symptoms which are not classical for knee or back or shoulder disease should be properly investigated. Parkinsonism should be one of the most common, most priority concern when a physician or a clinician is investigating a case of frozen shoulder or low back stiffness or leg stiffness. So these are some of the early signs of Parkinsonism one should look for.
With the current population, right? I mean, most of the things say that Parkinsonism and Alzheimer's, they both develop at a geriatric phase, in the geriatric phase of life. So with the population and some statistics saying that by the year of 2030, like in the next 10 to 15 years, a very large population in India is going to be in this sector or in this segment. So how prepared are we as a country, or how educated are we as a country to handle these situations or these conditions?
Fortunately, the answer, I mean, yes, the number of Parkinson's and Alzheimer's patients will go on increasing for multiple reasons. One, we are identifying them more readily because more specialists are around now. Secondly, the education and the internet has made it, the treatment strategies available are, I mean, even an MD physician can very well treat a Parkinson's or an Alzheimer's disease to a fair extent. Not all the time a neurologist is required. But at the same time, expertise lies in also knowing what not to do. And that's where we lack expertise in India, that people usually, when they read and treat something, then they are potentially creating another set of complications, because not all medicines are safe in both Alzheimer's as well as Parkinson's. So we are well prepared as regards the available expertise. Only problem happens when the population do not know that, and they reach the doctor too late. We are a very superstitious and illiterate country. Superstitious people are common in all socio-economic groups, very rich and very poor also. But these people usually avail of one, spiritual, two, some quackery, three, some alternative medicine, naturopathy, this, that. After doing all of this, they will come to a physician for a proper diagnosis or referral. That is the major problem in India. But the skill is available. I mean, I see at least 1 or 2 cases of Parkinson's every day. So that becomes about 60 patients in a month, and most neurologists see this number. So it's quite a well-established practice in India now, Parkinson's as well as Alzheimer's. Very good physicians, neurologists are available for treating these. As you said, it starts usually after the age of 60, but we are also seeing a lot of Parkinsonian patients in the younger age group. Not as much Alzheimer's. Alzheimer's is very uncommon before 60, but Parkinson's can be seen as young as 26 years old. I have at least 10 patients who are in the age group of 25 to 35 with Parkinson's.
And doctor, what are the main causes of these two conditions when we talk about Parkinson's and Alzheimer's?
The very honest answer is we have not yet zeroed in. We don't know the conclusive final answer as to what causes it. There is definitely a genetic element. There is some genetic component to development of this disease, but that alone is not sufficient. Some external factors are also responsible. Now, in case of Parkinson's, we know certain factors that are definitely associated. Drinking of well water, vihri se pani pine. Secondly, fertilizer or chemical exposure. There are lead paint factories, lead factories, or where toluene is used, or fertilizer sprayers amongst the farmers, they are very, very likely to develop Parkinson's. People who have had a poor socioeconomic status, poor diet, people who have had head injuries in the past, people who have lived a kind of not very intellectual kind of life, not used their brains beyond physical skill set, are also likely to develop degenerative diseases of the brain later on. As for Alzheimer's, genetics is the most common factor, but again there are certain other factors, some dietary factors which are implicated. We have not proven any of them.
One more thing I wanted to talk about today is that when we look at these two or these three concepts, right, especially activity levels, nutrition, and sleep, these three things, how effective are they when in treating or even in management of the conditions?
That's a very good question. I'll answer it in a very straightforward manner without beating around the bush. That if someone is to develop either Alzheimer's or Parkinson's or any other brain chronic disease, a person who has slept well, has lived a disciplined life, has taken proper nutrition, and has been physically active, in spite of developing Parkinson's or Alzheimer's, he will add a few more years, 5 to 10 years to his life.
Oh, and so being right now what our country is facing, right, is this whole thing about eating a lot of junk food or going towards obesity a lot. These things are extremely important, not only in the management but also for the preventive or the prevention of any chronic condition.
Yes. So one of the major things that that is coming out now is that when we say degeneration, we presume that only a small change is happening in the brain, that the brain cells are dying. Whereas in whether it is Alzheimer's or Parkinson's or any other disease, there are additional factors also taking toll on the neurological functions or the brain's life. One of them is closure of small blood vessels. And closure of small blood vessels is very common. It's like wrinkling of the skin as we age. The small blood vessels in the brain are also closing down. So closure of the blood vessels is dependent upon, one, how much active you are, and two, how much nutrition care you are taking. So people who are diabetics and hypertensives, people who are smokers, these three groups have a very high propensity to develop small vessel damage, small vessel blockages in the brain. And in them, the effect of Alzheimer's or Parkinson's is far worse than normal Parkinson's or Alzheimer's patients. Plus, the burnt fast food is one of the most common reason for people developing neurological damage earlier than they should have developed otherwise, had they had good nutrition. It has been established quite well that almonds and walnuts usually add a lot to the survival of brain cells in especially Alzheimer's patients. So the diet should be more consisting more of dry fruits, especially almonds and walnuts. But it should be only consumed if you don't have allergies, and it should be with a dietitian's and nutritionist's supervision only that you should do it. But otherwise, a good bland diet with supervision and physical activity are both very essential for not only patients who want to avoid neurological disease, but patients who want to live longer and keep their brains function optimal. A small change in diet is going to cloud your brain's function. So please make sure that the diet is always very good.
I mean, I couldn't agree more on this topic, Doctor. Thank you so much. Yes, and Doctor, just one last message if you have got and especially to Indians and the people who are watching right now on these topics.
See, the most important medicine in life is being active. A person who's active is actually killing diseases every moment that he is active. The second most important thing is what you eat. What you eat determines the quality of function of your brain, quality of function of your heart, and the number of days that you will live. It is as simple as that. So be active, eat very cautiously and carefully, eat well, and make sure that happiness is an ingredient of your food. So I am against diets which do not make a person happy. So happiness should be an ingredient of your diet. That's what I would say.
So with the, I mean, in the current pandemic, it's great. I mean, I actually can't even imagine what every doctor or every medico is going through right now. The risk that you are taking for curing people and for saving people's lives is absolutely amazing. And Doctor, a real hats off and a salute to you and all the other doctors who are doing this for us. So thank you so much, Doctor. And right now, what I'm doing is now I'll be showing all your handles on all your social media handles on this page, because I have been following you since a long time and your posts are very informative, and actually they create a lot of awareness about what is exactly that is going on in the life of a medico and in our country. So thank you, Doctor. Thank you so much for your time.
Welcome. Please do share the link. I will also share them. Thank you.
Absolutely. Thank you.
Pleasure talking to you.